I think one of the first things that I need to say is that when this first started, it's been 5 weeks now, and so much has changed, and we've done so much during that period that it's quite unbelievable, really, what you can achieve in such a short space of time. And I'm sure, as everybody knows, we're in a level 4 national incident situation, so it's very much led from government and brought down to us, so a command and control situation, really. So 5 weeks ago, we went into sort of critical incident mode within our services, and we had to move really quickly, stop all normal work and just focus on this situation that we were in. And it was about being really responsive as well, which we've enjoyed it. Actually, we've enjoyed being really responsive, but it has been difficult at times. One of the first things that we decided to do is set up a central HQ within our women's and children's area, so that all the managers could come together, sit round the table, and we could sort things out very quickly, what needed to be done. So as you can see, from this is based on our service and what we did. So I'm just using our service as an example. Just to give you an idea of the scale, 71 service change forms we completed and put in. So we've made 71 different changes to our services. The main source of guidance, as I'm sure you're aware, came from the Royal College of Obstetricians and Gynecologists and from the RCM as well. We found that really useful, that they were updating their guidance. And currently we're on version 8 of the pregnancy guideline for COVID-19. And the guidance always comes out on a Friday afternoon or evening, which sends us into panic mode just before everybody's trying to finish, before they finish work on a Friday. So, but us, we've put managers on call over the weekend, and we've always had a senior presence around. We've had a senior manager on call 24 hours to help staff be enabled to deal with the issues that have come from this crisis, really. So as well as the pregnancy guideline from the RCOG and RCM, there's also been other guidelines that they've done: antenatal and postnatal guideline, antenatal screening guideline, the newborn screening guideline, 5-day blood spot guideline, guidance for midwifery-led settings and home. And I think there's another version 1.4 of that as well. Self-monitoring for blood pressure in pregnancy guideline, speciality guide for intrapartum care, version 1.9 we're on, and scanning in pregnancy. So there's been lots of different guidance that's come out that we've all had to adapt to and comply with. So obviously these are huge changes for staff to deal with. So we just made basic boxes within each area and made sure that we updated the guidance every time something new came up. We would get rid of the old guideline and put the new one in, and did a lot of it through social media on our Facebook work groups to make sure staff were informed and knew what was happening. I'll come on to the issue of PPE a bit later on, because that was a bit more complicated for us, but and I'm sure for everybody. But what was also interesting, and sometimes it was a relief in a way, was a lot of the programmes were paused. So NHSR, it was no longer necessary to report early notification cases to NHS resolution, and they're going to review that in September 2020. HSIB as well reduced the cases that needed to be reported. They're going to triage the cases and do them by priority, which makes it a bit easier. Embrace guidance as well. We still need to complete that, but they've done a 3 list criteria, which has been really helpful. The organisations came up with things really quickly, which I thought was very helpful. So it helped us put a lot of things on the back burner to enable us to focus on other things. So Each Baby Counts as well was paused for 3 months, and HSI and the Maternity Transformation Programme paused. So, for example, all the continuity of care targets are put on hold. Submission for the neonatal critical care review, those implementations were put on pause as well. NHS Digital said that we didn't have to comply with the things that they needed doing. So that was a relief as well, in a way. And the digital maternity record standard compliance as well was paused. So those things helped us. And one of the biggest things was the CNST safety actions, because as you know, it's becoming harder and harder every year at the moment to comply with all the safety actions. So to pause those has really helped us. I've just put the examples there. I won't go through them all in detail, but just to say that all the safety actions mainly have been paused, except for things like Saving Babies' Lives Care Bundle. We're still continuing with that, but modified the scanning part of it, and also the CO monitoring of pregnant women is paused because of the respiratory issues associated with that, obviously with COVID. So those things have really helped. I would say our key service changes, I could go on about all of this all night really, but I'm conscious I've only got 15 minutes. So I'm just going to go through our main key service changes. So one thing for us, which we weren't expecting, we love providing a home birth service, but we quickly found that we had issues with staffing due to either people having symptoms of COVID or shielding or self-isolating. And our midwifery staffing went down by 25%, and 40% of our community staff were affected by that as well. So we really had to look at our home birth service, and unfortunately we had to suspend it at that point to enable us to cope with all of the work that was needed to be done within community as well. We quickly adapted all of our community services, swiftly changing a lot of things to virtual things that we could do. Luckily for us, we have Jude Jones, who works with us, who did the Face Mums project. So Judy's shielding, so she stayed at home, but she sorted all of our social media stuff out. She's been brilliant, and she set up little private Facebook groups for women to join and provide support through those groups. So she moderates those groups as well. So any questions about COVID or anything, they can join those groups, but they'll also get antenatal information, our hospital tours, our parent education programs, all things like that they can access, which has been really useful. We've tried to push everything, all of our messages through social media, so women are really well informed. And because the changes have happened quickly, sometimes it gets a bit confusing of what those messages are. So we've had to try and make sure that they're very clear and concise about what we put out. So I think that's worked really well for us, especially having somebody leading that and in charge of it, so to speak. So she just picked it up and run with it, which has been brilliant. We've also put things like we provide hypnobirthing classes to every woman if they want it, and we've put all that online. So one of our midwives, our community midwives that is shielding at home, she really loves hypnobirthing, and she's done a programme that women can access virtually. So she does that on a regular session on a weekly basis, which is brilliant. We also had to look at reducing elective section lists and things like that, because our anaesthetic team were being pulled into the issues with ITU and having to support more patients there. So that was starting to affect what they could provide for us. So we had to spread our section list out over 5 days instead of just doing it across 2 days. So that was something that we had to react to as well. One of the other things that happened was that at 4:30 one day, we got a call from the children's centre leads to say that they were closing all the children's centres that evening for probably 12 weeks and wouldn't reopen them. And all of our women were booked in there for their antenatal care with the midwives, because all of our clinics are in the children's centres. So we had to quickly try and rush around to try and find somewhere else. The LMS were really helpful with trying to find different places for us, like village halls and things like that, for us to enable to get women there for the next day, that first day that it had closed. So our community midwives were phoning around women late at night to try and enable that to happen. But then we talked to the children's centres, and they did enable opening 3 back up for us, which has been really helpful. So it was just things kept happening so quickly last minute that we had to be really reactive with. We've suspended our acupuncture service. We provide a really good acupuncture service, but that's suspended at the moment. But that's probably the only thing that we've had to suspend, apart from the home birth service as well. We also, at that point as well, had 50% sickness with our, not sickness, but due to COVID-related issues, had 50% of our obstetric consultants that were off as well. But now we're in a different situation. Our staff have started to come back, so that's increasing, and we're not having as many staff go off, which is great. So the balance is starting to tip back again now, which is great. So we've got 100% of our consultant obstetricians back in work, which is brilliant. And instead of 25% of staff off, we've got about 15. So it is improving slowly. So hopefully we're intending to relaunch our home birth service within the next couple of weeks, hopefully. Okay, thank you. So one of the other things was visiting and women being really disappointed about their partners coming, especially like through induction and coming to the wards. So that's been really difficult for the midwives and for us, and also wearing PPE and masks and things like that. I'm just going to flick through the stuff that we've done, but we've done so much work on PPE, you wouldn't imagine, honestly. It seemed like it was changing every 5 minutes, what we needed to wear, what we didn't need to wear, and what we had to wear for this and what we had to wear for that. And the RCOG and RCM guidance has been invaluable with that, because the whole hospital all works together on one general perspective of PPE, but we're very different, aren't we, with labour and birth? So that's been something that we've had to harness. So our consultant midwife and practice development midwife just picked that up and ran with it, and they did grab bags for the midwives to take into the rooms that we identified for women that were suspected or confirmed cases, so you didn't have to keep coming in and out and things like that. So it was just looking at everything. And the consultant midwife and practice development midwife have done loads of videos as well. This is how you don, this is how you doff, this is what you need to wear for second and third stage of labour, this is what you need to wear for the first stage of labour, and this is what you need for theatre, all of those sort of things, and worked with the medical staff as well. And we worked together really well as a multidisciplinary team. But it's been challenging at times, but in a way we've really enjoyed it, and a lot of the things that we've changed we're going to keep moving forward as well, especially a lot of the virtual stuff and things like that we've done. So yeah, there's been a benefit to it. Things that we've wanted to change for a long time, we've just been able to do because of COVID, really. And that's really helped us to make change a lot quicker than what we would have done without it. So
fabulous. Fabulous, Tracey. Thank you very much. I especially like the slide with mask etiquette.
Yes.
And I think what your talk really illustrates is the nimbleness of having all that information and having to work so quickly.
Yeah.
Right, for your team. I think that was really very, very helpful.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.